Why therapy doesn't help with depression, analyzing the reasons and possible solutions. Therapy has long been recognized as one of the most effective methods for treating depression. However, despite its proven efficacy, not all patients experience improvement in their condition after undergoing therapy. The question of why therapy sometimes fails to help with depression is a concern for many, and the reasons for this phenomenon can be varied. It's essential to understand that numerous factors can influence the success or failure of therapy, and addressing these factors is the first step toward finding solutions. Number 1. Incompatible therapist. One of the primary reasons therapy may not help with depression is a lack of rapport between the patient and the therapist. A therapeutic relationship requires trust, openness, and mutual respect. If a patient doesn't feel comfortable or cannot trust the therapist, the treatment process may be ineffective. A therapist may be a qualified professional, but if their style doesn't suit the specific patient, it can become an obstacle to recovery. The solution might be finding another therapist with whom the patient feels a greater connection and comfort. It's important to remember that changing therapists is not a sign of failure. It's a natural part of finding the right approach to treatment. Incorrect therapy method. There are numerous therapeutic approaches, including cognitive behavioral therapy, CBT, psychoanalytic therapy, interpersonal therapy, and others. Not every method is suitable for all patients. For example, CBT might be highly effective for some individuals, but it may not work for those whose issues are related to deep-seated emotional traumas requiring more in-depth analysis and processing. Finding the most effective method for a specific patient is crucial. In some cases, a combination of different therapeutic approaches might be necessary to achieve the desired outcome. This requires flexibility on the part of the therapist and the patient's willingness to try different methods. Number 3. Expectations from therapy. Sometimes patients expect rapid and drastic changes from therapy, which can lead to disappointment if improvement doesn't happen as quickly as they'd like. Therapy is a process that takes time, and results may appear gradually. Unrealistic expectations can cause a patient to view therapy as ineffective, even though progress may be occurring, albeit slower than desired. The solution to this issue may involve having a more open dialogue with the therapist about the goals of therapy and the possible timeline for achieving results. Understanding that therapy is a long-term process can help the patient focus on gradual but sustainable changes. 4. Insufficient motivation for change. For therapy to be successful, the patient must be willing to change and actively participate in the process. Sometimes depression can suppress motivation, and the patient may not put in enough effort to work on themselves. It's important to understand that therapy is not a passive process, and success largely depends on how actively the patient is willing to work on their condition. A therapist can help the patient realize the importance of active participation in therapy and maintain motivation throughout the treatment. This may include homework, self-help practices, and regular discussions of progress. Inadequate medical treatment. Sometimes depression can be so severe that therapy alone is not enough and medication is required. If a patient is not receiving the necessary medication or their treatment is insufficiently effective, this can hinder the success of therapy. In some cases, a combination of medication and psychotherapy is necessary. If the patient does not experience improvement, it's important to consider the possibility of revising the medical treatment and making adjustments in collaboration with a psychiatrist. Influence of external factors. External factors such as stressful events, family issues, work problems, or relationship difficulties can significantly affect the therapeutic process. If a patient continues to face serious stressors, it may be difficult or impossible to improve their condition despite all efforts in therapy. In such cases, the therapist and patient can work on developing strategies to manage stress and minimize the negative impact of external factors. Sometimes it may be necessary to temporarily pause therapy to focus on addressing the primary issues affecting the patient's condition. 7. Incomplete awareness of their problems. Some patients may not fully realize or accept their problems, making the therapeutic process challenging. A lack of willingness for self-reflection and deep analysis of their experiences can hinder progress in treatment. it's important for the patient to be open to exploring their thoughts and feelings and ready to make changes in their perception and behavior. A therapist can help the patient gain better awareness of their problems using various techniques such as motivational interviewing or therapeutic writing to help the patient see their issues from a new perspective and work through them more thoroughly. Conclusion. Therapy is a complex and multifaceted process that does not always produce quick and obvious results. The reasons why therapy may not help with depression are varied and can include an incompatible therapist, incorrect treatment methods, unrealistic expectations, insufficient motivation for change, inadequate medical treatment, the influence of external factors, and incomplete awareness of one's problems. However, it's important to remember that a lack of effect in the early stages of therapy does not mean that treatment will not work in the future. Adjusting approaches, having more open dialogue with the therapist, and actively participating in the treatment process can significantly increase the chances of successful recovery.
If you are struggling with depression, personality disorder, or panic attacks, I invite you to join my secret Telegram community, where I regularly post strategies and exercises for managing stress symptoms, improving your mental well-being, and real stories of people who have gone through the journey to recovery.